I just wanted to take a few minutes to quickly review the COVID-19 vaccines. My name is Dr. Viju.Jacob, and I work at Urban Health Plan. So why did I choose to get vaccinated? So I chose to get vaccinated. I wanted to protect myself and my family. I wanted to make sure that I can help be part of reducing the spread in the community and to set an example for others, family members, co-workers, and the community at large. So everyone starts off with the question, are COVID vaccines safe, right? That's the big question that everyone has. The primary driving force for that is that many people sort of feel that the vaccine it rushed, right? It was too short of a time frame. How do we come up with this vaccine so quickly? There must be something that we skipped some steps along those ways. And I want to reassure everyone that the COVID-19 vaccines that are currently in the market, both the Pfizer and the Moderna product in the United States, went through all of the usual steps, right? So there are two regulatory bodies that sort of help review and approve vaccines, medications, et cetera, in the United States: the Food and Drug Administration, the FDA, and the CDC through an advisory committee known as the Advisory Committee on Immunization Practices, the ACIP. So the big difference between this particular vaccine and other vaccines is because this was a global pandemic, the American government, governments all around the world, essentially dumped in billions of dollars to help set up the production capabilities of creating a vaccine, right? So they took some of the risk out for the company. So typically when a vaccine company or medication company, pharmaceutical company starts a process of coming down the line of looking at a new product, they sort of have to put in all the money up front, right? So they have to think about, what product are we going to support? How much money we're going to invest in it? Is it worthwhile, et cetera, et cetera. So right now, the governments of the world sort of said, we're going to help set up the production runs, the bottles that the vaccine need to go into, the factories, the factory lines, et cetera. All you need to concentrate on is the technology for developing the vaccine. So then the other question comes into play. Everyone goes, what is this mRNA, right? If we haven't heard about this before, that's a new kind of vaccine. So what do we know about this? So mRNA actually has the study of mRNA technology has been around for almost 30 years. Predominantly, it was around some cancer research and some early work on vaccine development as well. And there were some sort of early studies on when we had the MERS epidemic previously from another variant of the coronavirus, as well as the SARS epidemic. So there were some already vaccine trials, thoughts about how to sort of establish this in the process. So it was a matter of all sort of things coming together in good timing. The other thing is typically when a vaccine manufacturer, or pharmaceutical company, or a lab or a scientist is studying a particular product, they want to sort of keep it to themselves. They want to be the ones responsible for developing a new thing. They don't want to share any information and stuff. And when it came to the coronavirus, when they first were able to sequence the coronavirus in China, they basically put it out to the world. They said, this is the sequence of the coronavirus. Everyone can have it. Please start working on something to help us understand this better, how the infectivity works, et cetera, et cetera. So there was a lot of sort of communal sharing that happened worldwide. So the combination of the sharing of information, the government taking some of the risk out of the back-end production capabilities for creating the vaccines, and the technology had already partially been studied for other purposes, so they were able to repurpose it for this purpose. So that was some of the things that allowed us to speed the process along. But even after all of those sort of baseline items exist, we still have to go through the safety trials, right? So both of these vaccines went through all of the safety trials. So when we sort of hear about the phase 1, phase 2, phase 3, phase 4, et cetera, what that means is basically, you start off with sort of seeing, does it even work in the lab? If it works in the lab, then you may try, animal models or models that sort of do computer models to sort of see how it works in certain populations. If you sort of see that seems safe, then you enroll people in vaccine trials, right? So that's what a phase 3 study is. People volunteer to be part of vaccine trials. Under controlled circumstances, they're administered the vaccine, they're monitored, they're very closely monitored for what side effects they're having, does the vaccine work in the general population, et cetera. And only after the pharmaceutical companies sort of go through all of these steps and their internal studies show that this seems to be showing an effect, when you sort of look at the risk versus benefit, the benefit outweighs the risk. Then they put it out to the FDA and the CDC to evaluate. So then people, unfortunately, in the times that we live in right now, are worried about, I don't trust the government. The government is right now in a place where I'm not comfortable with what they're making decisions on. They just are rubber stamping things. And I want to reassure people that at both of these federal governments, the FDA agencies at the federal government, the FDA and the CDC, there are advisory panels which are basically the national experts on all of these items, right? So it's not government employees. They are the experts on vaccines. They are the experts in pharmaceuticals. They're the experts in, how to safely roll out things, et cetera, who sit on expert panels who look at the data, scrutinize it, and at that point make a decision whether they should recommend it to these federal agencies and stuff. So it's not just the federal government thing, it's the experts in our country who've looked at this and said that these vaccines are safe to proceed. We will continue to be monitoring this, right? So what's known as the phase 4 trial is even after it's in the general public and given to groups, they continue to monitor the people that was part of the vaccine trials, and they're continuously adding new people to the vaccine trials, especially different age groups, et cetera. So the monitoring continues even once a vaccine is rolled out. So who were in these vaccine trials, right? So both the Pfizer and the Moderna vaccine, were able to recruit a big chunk of people because this was a global pandemic. A lot of people were interested in joining vaccine trials, right? Typically, a smaller, less important, I shouldn't say less important, sort of, a less, a vaccine that has less urgency, that you may get, a couple of thousand people who join a vaccine trial. It takes time to sort of build up that population and stuff. In the COVID-19 trials, because it was such a global pandemic, you had a lot of people sign up for these vaccine trials. And that's why we have a lot of data to make our determinations. We were also able to get a lot of diversity, right? So there was, in the Pfizer trial, you had 10% African Americans join and 13% Hispanics. In the Moderna vaccine trials, you had 10% African American, 20% Hispanic and Latino. And they were also able to get a spread of ages, right? So they were able to also look at the higher risk age group, which are the older age groups. So this doesn't mean that this was a perfect recruitment, right? So not every single race and ethnicity was matched up exactly to the general population. Also, you typically in vaccine trials or any medication trials, healthy people are more likely to volunteer than people that have other medical conditions or maybe medically fragile and stuff. So that's a given in any sort of trial, and that's was a given in the COVID-19 vaccine trials as well. So what vaccines are currently available in the United States? So right now, there are 2 vaccines out in the market, the Pfizer vaccine and the Moderna vaccine. Both of these use this technology known as mRNA, messenger RNA, in their immunizations. And like I mentioned before, the technology has been studied for almost 30 years. It's just the first implementation of that technology in the use of vaccines. And if the simplest way to sort of explain messenger RNA is, think of it as exactly what it is. It carries a message, right? It's telling our body, this is what the COVID spike protein looks like. So, what the COVID spike protein is, everyone sort of, we're all sort of watching the news and we see that ball and those little red things that come out of it. Those little red things that come out of it is a representation of those spike proteins, right? So this is basically showing your body, what the spike protein should look like. And then your own body is making the immune response, right? It's making the antibodies. There's nothing coming from the outside to do that for you. It's just sort of saying, here's a message, this is what it sort of looks like, so now start making stuff for it. It's almost like a recipe book if you want to think about it. The messenger RNA does not enter what's known as a nucleus, the part of our body, our cells that has the DNA. So because it does not enter the nucleus, it does not affect our DNA. And the vaccine material itself actually is pretty fragile. It breaks down pretty aggressively, right? So they actually have to coat the messenger RNA with fats to keep it around long enough so our body can recognize it and start making those things. So the messenger RNA breaks down pretty quickly and is taken into our cells to get rid of it like everything else. Both the vaccines currently available in the United States require 2 doses, right? So the Pfizer vaccine is a minimum of 21 days apart, and the Moderna vaccine is a minimum of 28 days apart, right? So if you got it 30 days apart for the Moderna, it doesn't mean you need to start again. It just means you have to have a minimum time frame of these 21 and 28 days for the two different vaccines. Because the vaccines weren't studied together, we can't say that they're interchangeable, right? So each of the vaccines, if you got the Pfizer for dose 1, you have to get the Pfizer for dose 2. If you got the Moderna for dose 1, you have to get the Moderna for dose 2. So right now, you have to get the same product both times around. So, everyone sort of wants to know, what are the vaccine components? So these are just sort of the basic vaccine components in there. And, my message to most people is, if you think about it, it's a fairly short list, right? So yes, it has complicated names, but it's a very short list, right? Even if you sometimes look at some packets of bread on the ingredients are in there, there's sometimes like 30, 40 little things that are in there and stuff. So relative to that, these are very few sort of things in there. And if you look at it, both of them, the active ingredient is just that message, right? That messenger RNA that sort of is sending the message to our body that, we need to make antibodies to it. The fats that are in there help to coat this, and it allows for it to last long enough for our body to recognize it. And then the salt and the sugar just stabilize it and stuff. There aren't any preservatives in there per se. There isn't thimerosal, so there's a lot of concern. People sort of say, in some of the older vaccines, there was thimerosal as a preservative. I don't want thimerosal in there and stuff. There's no thimerosal in these practices. For the Moderna vaccine, which is what a lot of non-hospital settings is currently giving out, the one medication that it may cross-react with, if you have a previous history of an allergy, is this thing called polyethylene glycol, or PEG. And where most people are exposed to polyethylene glycol is if you've ever had to have a colonoscopy or something where your bowels have to be cleaned out. That's typically that medicine that people get, the night before. You're supposed to drink mix it with water and drink it so that, it clears out your bowel and stuff. So that's where the polyethylene glycol is. So that's the only sort of, true other medicine that it may be related to that's in the vaccine components. So how effective are the vaccines? So both of them, the Pfizer and the Moderna vaccine, are greater than 90% effective, so closer to 95% effective after you get both doses. There are some indication that after dose 1, you may have about 50% protection from both of the products. And there's similar efficacy in the different races, ethnicity, ages, so it seems to work across the board. So what were some of the side effects that we've noted, right? So in the actual clinical trial part, there were actually no severe side effects reported from any of these trials, right? So talk about severe side effects. So there are side effects, right? So like a lot of times when you get a vaccine, so if you've ever had a tetanus shot or flu shot before, sometimes you can have some pain where you got the shot. With the flu shot, sometimes, you can feel like you got a little achy or, get some pain in the arm, it may feel numb, et cetera, and stuff like that. So those kind of stuff also happen with the Pfizer vaccine, right? Because it's an injection, right? It's not like someone tapped you in your fingers, someone put a needle to give you an injection and stuff, right? Because it's activating your own body's immune system to sort of create those antibodies, it's almost like if you caught a cold and your body's making a lot of antibodies to fight that off. You may feel fatigue or headache or muscle pain and things like that, right? So that's just a sign that your body's actually creating those antibodies. And the only thing that's specific to the Moderna vaccine is you can get lymph node swelling, typically in the same side where you got the vaccine, so under your arms or above your clavicle, the bone that's, by your shoulder and stuff. So you may get some lymph node swelling. It may be tender and stuff for a few days, and it typically goes away. Most of these side effects start around, so if the day you got the vaccine is considered day 1. So they typically start on day 2 and day 3, and usually gets better by day 4 and day 5. And sometimes, the pain may be bad enough that you have to take some Tylenol or Motrin, or, if you have a fever, you may have to take some Tylenol or Motrin. But, the reports have been that most people get better in this sort of time frame. And again, it's a sign that, the side effects basically are showing that your immune system is actually working. With both the vaccines, the side effects with the second dose tends to be a little bit more than the side effects with the first dose. So not that it's a absolute that it's going to happen, but as a general rule, people have more side effects with the second dose than with the first dose because your body's already been exposed to it, and your body will generate a greater immune response the second time around and stuff. As with any medication, right, so vaccines are a type of medication, there's a remote chance that the vaccine will cause a severe allergic reaction, right? So that's a given with almost everything. But that being said, as of the weekend of January 10th, there were about 6.6 million doses of vaccine administered in the United States, and only 29 cases of true anaphylaxis reported, right? So that's the severe reaction where, you know, you have difficulty breathing, your throat swells up, you need to get an EpiPen, you need to get monitored and stuff like that. So there have been 29 cases out of 6.6 million doses given. And most of these cases have been reported to the Pfizer product. So not 100%, but most of them are reported to the Pfizer product and stuff. And just to sort of put that in perspective, in December, there were as of December, there were 6.4 million cases of COVID. And in December alone, we had 77,000 deaths, right? So, you know, that's your risk-benefit analysis, right? So yes, vaccines may have side effects. Yes, there's a small chance that there may be some anaphylaxis, but, you know, getting COVID has consequences as well, right? The vaccine has no part of COVID in it, right? So it can't give you the COVID-19 disease from getting the vaccine. It also does not typically cause respiratory symptoms, right? So cough, runny nose, those kind of things, right? Loss of taste or smell. If you feel any of those sort of things, you may have a true infection, right? So just because you got a vaccine today doesn't mean tomorrow you're protected, right? So if you happen to be exposed in the grocery store or down the hall or with a family member and you got a vaccine today, you may still go on to develop COVID. And those are when some of these other symptoms may kick in, whether the runny nose, coughing, loss of taste and smell and stuff, right? So if that happens, you know, you need to reach out to your provider, and you should be tested for COVID to make sure that you didn't actually have an actual infection and stuff. So what are some of the things we don't know right now, right? So we don't know absolutely how long the immunity from the vaccines lasts, right? So recently, Moderna put out some documentation, a press release that sort of said that they anticipate that at least lasts for a year. And, you know, people may say, oh my God, like that doesn't mean anything, like only a year. And part of it is because we've only had COVID around for about a year, right? So some of these things, you really need time for us to sort of say, you know, what happens to our body over time, right? And the example I always like to use is the chickenpox vaccine. When the chickenpox vaccine came out, you know, 10 years or so ago, it was originally recommended that most people should get one dose of the chickenpox vaccine. And as people were getting the chickenpox vaccine and being monitored in these phase 4 trials, right, so monitored over time, we started to notice that the immunity wanes off after time, right? It gets lower with time. And so then a second dose was recommended. So that's not uncommon. Many vaccines, especially if you have children, you probably know that, you know, you're taking our children in at 2 months, 4 months, 6 months, et cetera. They're getting the same vaccine over and over again because that allows our body to sort of generate enough of an immune response so it protects us over the time frame where that particular disease may be at risk for us, right? So down the line, there may be additional recommendations that come by that says, oh, you may need a third dose, or you may need to get this dose like the flu shot, you know, once a year. But we don't know that until some time passes. So some of these people that were in the vaccine trials, as they've been vaccinated for a year, 2 years, et cetera, the pharmaceutical companies will be able to sort of monitor them and sort of let us know how much protection lasts in those time frames. What we don't also know is how safe and effective the vaccines are for children, and generally speaking, under 16 years of age, because, like I said earlier, most people aren't running to enroll their children in vaccine trials, right? Same is true for pregnant women or people that may have, you know, significant medical conditions and stuff like that. Typically, healthy people sign up for any sort of trial, right? In the Pfizer trials, they did enroll people 16 and older, which is why the Pfizer trial, the Pfizer vaccine is approved for age 16 and older. The Moderna vaccine right now was only tested in 18 and above, so that's why it's recommended for 18 and above. Right, both the manufacturers are currently enrolling children as young as 12. So hopefully, as we get additional data on those younger children, we can move the vaccine recommendations to a younger age group and, you know, all the way down to childhood and stuff. But that only will come with time. The other thing we don't know is because this is a relatively new vaccine, we haven't studied how this vaccine interacts with some of the regular vaccines, right? So flu shot, your tetanus dose, you know, other vaccines that we also get, right? So because we don't have enough data about it, the CDC recommends that we should leave a 14-day gap, a 2-week gap, So if you're going to get the COVID vaccine today, you shouldn't get any other vaccines for at least 2 weeks. Or if you got another vaccine, you should wait 2 weeks before getting the COVID-19 vaccine and stuff. So just a 2-week buffer on either end of getting the COVID-19 vaccine, just because we don't know how that affects either one of those vaccines, or does it make either one of those vaccines less effective? So we don't want to risk that. So we leave a 14-day gap. As I mentioned earlier, the Pfizer vaccine is approved for 16 years and older. The Moderna vaccine is approved for 18 years and older currently. So some special categories, right? So if you have COVID-19 right now, it's recommended that you finish your isolation period. And right now, the recommendation is a minimum of 10 days. You should be feeling better before you get the COVID vaccine. It's not so much because there's anything dangerous about getting the COVID vaccine if you have COVID-19. It's really, we don't want someone who's infectious going to a vaccine clinic, potentially infecting other people while waiting in line, etc. So that's really the reason why, if you have a COVID-19 infection right now, the recommendation is wait till your isolation is done, wait till you're feeling better, then you can get the COVID-19 vaccine. If you had a previous infection, so let's say last March, April, May, over the summer, whatever it is, you had a COVID infection, and some people have had their blood tested for antibodies, and let's say they have antibodies to COVID-19. It is still recommended that you get the vaccine, because the current recommendation feels that the vaccine actually generates a much higher immune response than the actual disease. And because that immune response is stronger with the vaccine, it'll probably protect longer. So it's recommended that you should still get the vaccine. There's a special cause in that. So if you got COVID within the last 90 days, or if you got monoclonal antibody treatment in those last 90 days, the thought right now is that there is some level of protection from COVID disease in that 90-day window. So you may choose to wait till that 90 days is done to get vaccinated. So right now, as you know, there are more people in the categories of folks that can get the vaccine than actual vaccines out there, right? So, if it's a choice between you and your grandma, and you just had disease in the last 90 days and grandma hasn't, you may want to let grandma get the vaccine first and you wait 90 days and then get the vaccine. So it's not that you can't get it in that 90-day window, it's that you may voluntarily postpone it during that 90-day window because you do have some level of protection. We also don't have data on pregnant and lactating women because they really weren't a significant portion of the study. So there were some women who became pregnant during the course of the studies, but it wasn't significant enough numbers to make general statements. That being said, both the American College of Obstetrics and Gynecology and the American Academy of Pediatrics for lactating women, breastfeeding women, say that the theoretical risk from an mRNA type vaccine is non-existent to very low. So you can, if you're in the eligible groups, still choose to get the vaccine. You should probably have a conversation with your doctor or your OBGYN of your own specific issues and then make that decision. There are many healthcare workers who fall into these categories who've already been vaccinated, and there haven't been any significant adverse outcomes reported so far. As for immunocompromised individuals, the issue here is because their immune system is weak, we don't know how much of a response they may generate after getting the vaccine, so they should still get vaccinated. But we can't say that that 95% number that everyone sort of tosses around in the media and stuff may hold true for immunocompromised people. So people who may be in cancer treatment, people who are on like long-term steroids, people whose immune system is weak because of some other condition and stuff. So again, you should probably have a conversation with your doctor. You should probably still get the vaccine. There will be some protection. We just don't know how much protection there is. The other concern that I've sort of heard floating around in social media is, oh, there's fetal material in there. This was taken out of fetal material. My religious beliefs don't allow me to do that. So the mRNA in both the Pfizer and the Moderna vaccine is synthetically created. There is no fetal material in either one of these vaccines. So you should put that fear aside and you can go ahead and get vaccinated. So who should not get the vaccine, right? So if you've had a severe allergic reaction to any of the ingredients that I listed earlier, you shouldn't get either of the COVID-19 vaccines that's currently available. If after getting dose 1, you had those severe allergic reactions, so like what we call anaphylaxis, right? So your throat swelled up, you had difficulty breathing, etc., you should not get the second dose. So the anaphylactic kind of reaction typically happens very quickly, right? It happens in that first 10, 15 minutes after you got the vaccine and stuff, which is why we observe everyone for a minimum of 15 minutes. And if you have a history of just like allergies to dust or pollen or to an oral medication, et cetera, you're usually monitored for 30 minutes before you're allowed to leave. This is talking about really those almost immediate effects that sort of kick in after you get the vaccine, the anaphylactic type reactions. If you've had what's known as an immediate allergic reaction, right? So within 4 hours of getting vaccinated, you develop hives or swelling or wheezing and trouble breathing. Even if it's not severe, if it happened in that 4-hour window, right now the CDC recommends that you should not get the second dose. So if you got dose 1 and within 4 hours you got hives, swelling, trouble breathing, which is known as an immediate allergic reaction, you should not get the second dose right now. That's the recommendation. Now, if you've had an immediate allergic kind of reaction to other vaccines or injections, then you should probably not get the COVID vaccine. You should have a conversation with your doctor, but if you've had an anaphylactic kind of reaction to an injection or a vaccine before, you should probably hold off on the COVID-19 vaccine. If you have an anaphylactic or emergency kind of reactions to oral medications, the medicines you take by mouth, or to like seasonal stuff or food, etc., you can still get the vaccine. You just need to be monitored closer and for 30 minutes before you are allowed to leave the vaccination area. So how do we know these vaccines are safe over time, right? So we've always had this system called Vaccines Adverse Events Reporting System, the VAER system. So any vaccine that's ever been given, people can self-report on the website or by calling a phone number to VAERS that they had some sort of reaction, right? And the VAERS folks look at this, and if they deem it to be significant, they reach back out to you and follow up and stuff, right? So that's always been there. It continues to be there for this product. As we're now in the 21st century for the COVID-19 vaccine, they've actually started a second program called Vista. It's a smartphone-based app, right? So when you get your vaccine, at the location where you get the vaccine, they'll give you information on how you enroll in the Vista program. It's a website. For the first time you have to go to the website, you provide some general information about yourself, a cell phone number that they can text you at, and when you got the vaccine and which vaccine you got. Once you do that, it's free. Participation is voluntary, so you can choose to not respond at any point, right? But once you register for that, you get a daily check for the first week, and then weekly for 6 weeks, and then at 3 months and 6 months and a year afterwards, you get a checkup to make sure how are you doing. And it asks questions like, well, how are you feeling today? Are you having pain? List some of the symptoms you're having, et cetera, right? As you report these symptoms, there's someone monitoring on the back end, and if you report significant symptoms, you may get a call back from someone at the CDC to sort of follow up with you and give you additional recommendations and stuff. When you get dose 2, these timelines reset again, right? So after dose 2, again, you will get notified weekly for a week, and then daily for a week, weekly for 6 weeks, and then at 3 months, 6 months, et cetera, and stuff. So this is a way to sort of real time keep track of what side effects are people feeling, even if it's minor, how long is it lasting, et cetera, so we can have additional data for people coming down the line. So we all got the vaccine. Can we stop wearing the mask, right? So unfortunately, not right now, right? So yes, the vaccine is effective, but even at best, the vaccine is only protecting 94 or 95% of the people, right? So there's still a 5% chance that you were in that group that didn't generate a response, right? And not everyone can get vaccinated immediately, right? There's some time between when all of us can get vaccinated, right? So because of those two realities, we still need to continue wearing our masks. We still need to do all the things we're doing right now, hand washing, social distancing, et cetera, right? So isolation, quarantining, et cetera. So for now, even after you get vaccinated, please continue to do all the things you've been doing to keep us safe all this time. So these are the current priority groups as of today, right? So New Yorkers, 65 and older can get the vaccine. People in healthcare can continue to get the vaccine. They've added groups like first responders, public safety workers, public transit workers, correction officers, et cetera. So this list is going to continue to get expanded as more and more vaccines are available. Most jurisdictions, so in the city health department are setting up multiple, 24-hour locations. The state is setting up 24-hour locations at places like the Javits Center. Many federally qualified community health centers like Urban Health Plan have vaccines that we're administering to both community partners and to our patients in the priority groups and stuff. So yeah, go check out the health department's website or Urban Health Plan's website to sort of see when vaccines are available for you. Typically, most places are asking, are prioritizing based on this group, the groups, and we have to be patient. So this is going to take time, so there is a limited supply of vaccines. As we get vaccines, we'll try to match it up as quickly as we can to the eligible groups to get it out there. But again, when your group is eligible, I encourage all of you to get vaccinated. I've started the process of being vaccinated as a physician that's in the front line. My wife, who works in a hospital, has also been vaccinated. She actually has gotten both doses and did perfectly fine. My brother, who's a volunteer EMT, got vaccinated and is doing perfectly fine. So, please talk to, everyone around you and encourage them to get vaccinated. That's the only way we're going to get through this pandemic. Thank you for participating in this short webinar.